You're listening to the Turn Autism Around podcast, and I'm your host, Dr. Mary Barbera. Today we have a special guest, Dr. Ellie Kazemi, who is a behavior analyst, author, professor. She is out in California. I've never met her physically, but I have been following her work for years. She is an expert at supervision and leadership within the field of ABA. And today we talk all about ABA as a science, how she has consulted with NASA and FEMA, and how she has used everything she knows to help families of kids with autism, also kids with ADHD, ODD, and how we talk today how to spot good ABA and how to make mediocre ABA better, with just a wealth of information all about improving the lives of children with autism and related disorders. I loved getting to know her better. Hope you do too. Here's Dr. Ellie Kazemi. Thanks so much for joining us today, Ellie. I'm super excited to have you on.
It's awesome to be invited on this podcast. Thank you so much, Mary.
Yeah, so I've been following your work for a while, and but I don't think we've ever met in person. Hopefully that will happen soon. So why don't you tell me and my listeners about your fall into the autism and ABA world?
Well, that was a really long journey. So I'm going to try to keep it short by explaining that I did my doctoral work in clinical psychology. My area was actually focused on learning disabilities and attention deficit hyperactivity disorder. I was really interested in that achievement gap, for these individuals. And with that came a lot of literature and clinical recommendation with oppositional defiance and how to actually have joint attention and how to bring things to be organized. And that's how I found behavior analysis. It was in the clinical recommendations that I found this work, as well as a colleague who was actually a student who was serving in the lab and helping me at the time, who introduced me to some behavior analysis literature. So I fell in love, absolutely in love. And that brought me to accepting a position at Cal State Northridge to become a full-time faculty member there to develop the program in behavior analysis. That journey, I think, has a lot to do with how I came to ABA, but also how I then have kind of pivoted my career. I've moved away from some of the work that I was doing clinically and really moved toward supervision and leadership. Because when we started the program at CSUN, most of our students served families of individuals with autism, and those supervisors would come to us and say, we want to do the best we can. We want to be awesome supervisors, but we don't have the tools. Can you help us? And that's when I realized, well, we can't say no, just do a great job. If we really want good quality supervision, we want the next generation of board certified behavior analysts to be competent, we need to work with these supervisors. And that really led to the work that I do a lot in supervision and quality, actually looking at the quality of interventions and quality control, because I really realized we need to move toward helping the community put forth environments, create structures, create trainings that help them upkeep good quality. So that's how I fell into the field of behavior analysis, and autism specifically was working with those community partners and working and supervising students who were providing services.
Yeah, great. And I was just on the phone with somebody recently, a young woman, a friend's daughter, and she is thinking about ABA. She's thinking about getting her master's in ABA. And she was telling me that she really envisioned herself working with families, kids with maybe ADHD or mental health problems, depression, anxiety, those sorts of things. And, I was saying, which I'm asking you as an expert, is I'm thinking that 90% of BCBAs out there that are working currently are working with autistic individuals. Am I off with that?
I think 90% is high in percentage there. I believe the latest report that came out from the BCBA sort of outlines. Oh, I apologize. That's my dog actually alerting everybody about ambulance driving by. So that's what
no worries, no worries. We're dog friendly here, lawnmower friendly here. No worries.
Okay, Baba. Okay, Baba. That's up. He literally emulates the sound of the ambulance. It's an interesting
imitation.
not trained. And so I think I do think it's definitely the majority, which is what I believe is your point there, is the majority of individuals that are serving in the field of behavior analysis are serving individuals on the spectrum currently. But I definitely think that we do have a good percentage of individuals who are also beginning to do good work in brain injury, individuals who are helping folks with sleep disorders, pediatric issues. So we are beginning to see much more branching out, and a higher and higher percentage of individuals who are serving, especially in schools, individuals who are in need of support services that may not be on the spectrum. So we have the majority of folks who are serving individuals with autism, and the need will continue to be there. But we're also seeing people do other things. When I was working in the area of attention deficit hyperactivity disorder and learning disabilities, I was learning during that time, doing my doctoral work in clinical, I was learning how to do diagnostics, and actually learned to do differential diagnostics, which, I was, in love with. It was evidence-based, and I had fantastic mentors at UCLA. But what really shifted my career was a family that I became very close to, because the parent had a terminal disease. She knew she only had a few months to live, and her biggest worry was that her adolescent, who was very, very bright, was highly depressed, and that the world around him would never know his potential because he would make what appeared like careless errors, dumb errors. And sure enough, during assessment, I realized what was going on with him was a very clear executive functioning difficulties, and you could see he was unbelievably bright, but then his achievement scores, his school scores, were not anywhere near those, which had very much made him give up in school. And he was very clear about that, and I'm not smart enough, I'm just not good enough. And when I shared my psychoeducation evaluation with her and shared, here's what's going on, here's the profile, why this is happening, she looked at me and said, that's wonderful, but what do I do? What does he do? And I think that was really the first time I realized that I want to move toward actual effective care management more, because she was right. Identifying those things was that first initial step, but her biggest worry was she was going to leave him. She was going to pass, and she wanted to know he'd be okay. And I was not going to be able to say that to her. I had no idea what the care management team would look like. So that really, I think, shifted my career in many ways. And I think that finding behavior analysis has been a joy for me, because we can be such effective agents of change. When I worked with most of my students, and there was co-occurring attentional difficulties, co-occurring difficulties with oppositional defiance, I felt that I had better control over some of those things because I was familiar with that entire population. But I think that currently only about 15 to 20% of behavior analysts are really expanding to those other areas, which, you have to get to know the population.
And what about the master's level programs? That's what I was speaking with this young woman about is, as far as I know, most of them are heavily based on autism, like you were describing with your need to get supervisory skills up for autism, and I explained that the reason for that, not that all of these fields don't need it. I mean, I'm a registered nurse. I still am. And I was a rehab nurse and a neuro nurse. And like, we need behavior analysis in rehab centers, in nursing homes, in everywhere, in schools for kids with ADHD. But the reason that it's such a large percent, and I probably overstated 90%, but is because insurance pays, and the whole ABA field was based on, the treatment for autism after Catherine Maurice's book came out. And that's the reality. Not to say, so in terms of young people who want to pursue ABA, is it true that 90% of the programs or even more are heavily based on autism?
I think that is a battle we had to face at CSUN as well. So when we put our curriculum together, we knew that the majority of our students are going to service individuals on the spectrum. So if we don't have an autism specific course, we're not doing them justice. They must know the population well. They must understand the special things that go on for this particular population with regards to what co-occurs, what their life trajectories can look like, all of those things, as well as understanding development matters for that particular, group of individuals we serve. But at the same time, in our program, we wanted to expand students' experiences. So we have an entire course devoted to general psychopathology, what we call developmental psychopathology. And that includes things like sleep disorders and anxiety and depression. And I think that we are not completely unique. I do think that there are other programs that have a course that does allow that expansion. I haven't actually done an analysis to see how many though.
Yeah. Well, I think it's a growing area of need for sure. So before we move on and talk, directly to parents and families that are struggling, I do want to just talk about your book really briefly. You have a book from 2018. You're working on a second edition. Can you tell our listeners the name of the book and who it's for?
Sure. The book is actually to trainees or individuals who are seeking to become behavior analysts. And it's meant to be used by their supervisors to guide the supervision experience. And it is because of what I shared earlier. When we started the program at Cal State Northridge, we realized there's one thing to train people in the classroom. There's one thing to even provide practice opportunities in the classroom. And then there's another to put them in the clinical setting and provide them with the opportunities to experience those and receive feedback from supervisors. And that time frame, those community partners would come back to us and ask for resources, tools, experiences, and guidance. And we realized that supervisors did not have the support services they needed to be able to be good supervisors. And sometimes they needed more training. They also needed just support and material to be able to do it and to structure supervision so that it wasn't just time-based, it was really competency-based. Have you met these competencies? Do you actually achieve certain, things to be able to be a good supervisor? The efforts we put together with my colleagues, we put up on my lab website for some time and it was freely available. Then it was abused. Someone pressed print and started selling it as a book. So we went to Springer and asked if Springer would go ahead and host it, and they were happy to. So it's now published through Springer.
And what's the book?
It's called Supervision for Behavior Analysts.
Okay.
Supervision and Fieldwork. Yes.
Okay. We can link that in the show notes. I'm assuming you can get it on Amazon and
absolutely. And you can actually get it directly from Springer. And if you'd like, I can actually give you a code that gives anyone who is interested a discount.
Okay. We can put that in the show notes. Great. Awesome.
Perfect.
Okay. So let's kind of switch gears a little bit. We were talking very briefly and we're both behavior analysts. So we kind of are on the same page with, it really doesn't matter if it's ODD or ADHD or autism or executive functioning problems or sensory processing issues or sleep. It's the same process through ABA. And I saw in your bio that you even consulted with NASA and FEMA. And FEMA is the the place for flooding and stuff?
It's actually emergency services.
Emergency
My
service.
particular work is with firefighters. Yes.
Okay, firefighters and flooding and stuff when FEMA gets involved, when there's a hurricane, a devastating, wildfires in California, for instance, FEMA would get involved. So, and NASA is the, astronaut program and the space initiative and all that. So maybe we'll start there. Like, what did you do with them, or what are you doing with those organizations, and how does that relate to helping families and professionals working with kids with autism or other disorders?
Well, as you know very well, Mary, I think the power of behavior analysis is in the fact that we don't perceive individuals as morally bad, individually bad. We don't think that things that occur are internal or specific to someone. We look to the environment to see what's been the history, what opportunities has the individual had, and then what does that environment look like? And so this perspective that behavior is a function of its circumstances, I think, allows us to become allies with anyone who's looking at a problem that involves behavior, and many problems do. Human behavior is involved in one way or another. The other thing that I think makes us good allies as behavior analysts is that we're uniquely trained to look at behavior and measure it. For example, when my colleagues that had the FEMA grant came to us, it was the Andrew Foundation. They are a burn foundation, and they care deeply about prevention of burn. And they work closely with other organizations that are firefighters and are working during fires. And what they were really interested in initially was, they go out there, put a lot of time, effort in training young people how to escape fires, how to prevent burns. But they didn't know if what they're doing, if their training is effective. And I remember sitting in a boardroom with these individuals who save lives every day and who are brilliant. Their understanding of the world, I could never compare my understanding or knowledge of the world to the vast knowledge they have. And yet they didn't understand how to measure behavior, so much so that they looked at me and said, when we train our firefighters, we simulate, we set things on fire, we create combustions, and now they have to get out or put the fire out. We can't do that to our kids. And I thought to myself, right, you're right. You don't need that level of simulation to be able to measure the effect of your training. And so we worked closely with them to be able to actually measure how are they training, which obviously always when you say, how do I measure the outcome? It changes how you train. So they began to really identify key things that they wanted to change in their training. That relationship went so well for both. I think we learned a lot and they felt that they learned a lot, such that they have asked us to come back. And now we're working with them in messaging. They're really interested in being able to take large messaging that they do to the public and ask what should be the most effective components that may be missing there. For example, when you say to someone, what do you do when your clothes are on fire? They can say stop, drop, and roll. And maybe they can actually show that they can stop, drop, and roll. The problem currently is that the individual may also do that when you say your house is on fire, what do you do? And that's because the jingles of stop, drop, and roll have become very well known. But, from a behavioral perspective, we know learning occurs under a certain very clear antecedent, or what we call something right before the event needs to happen. So all that needs to change in that messaging is that it needs to always have the when your clothes are on fire, for example. Stop, drop, and roll. So, we've been working with them and revisiting some of their messaging and questioning some of these things. So that's been super cool work. And I think behavior analysis applies there because we can measure things and help in those ways. With NASA, it's a very different issue they brought to us. I was working with colleagues in engineering because of some of the work that we were doing in technology. They got interested in our students. We had, fantastic students that they wanted to involve in this grant. So we identified a problem. Some of the NASA scientists said that a big portion of what happens is that operators or engineers are working collaboratively quite often with robots. So there's a human robot interaction and teaming that's occurring. So it's not just teams of individuals anymore, it's teams of human beings and autonomous robots that have to work together efficiently. And, can we help identify key factors or components and what makes an efficient team? This project honestly has been a joy, because the individuals who got involved, the students who got involved, were probably students who would twitch at the notion of ever coding or twitch at the notion of that level of science and math and technology. But, it's amazing when you get involved in a project where the outcome is something so cool, so important in the future, that the students have been very, very interested and have been creating simulations and studying that from a very behavioral perspective. How do we measure teams, and how do we measure performance, and all the things that we can learn from organizational management and apply that to those projects. So the individuals who've been involved in that project have been doing great. And hopefully, actually, the lead person on that project, Hadisa Patah, will be continuing an internship with JPL. We're working on that at this time.
Wow. So it sounds like a lot of OBM, and we have done a couple shows. We can link them in the show notes on OBM, but can you refresh our knowledge of OBM, what it stands for and what it is?
Sure. So organizational behavior management, which is what OBM stands for, is the application of behavioral principles, what we understand when we work with individuals, to organizations. So we're applying those very things to understand what's happening within the culture or the setting of an organization. And we look at human behavior very similarly. So it's taking that same approach. That, one employee may do very well in one organization under the right circumstances. They might cheat, lie, steal even under different circumstances. And that how you set up an organization will influence employee behavior.
Yeah. It really, as you're talking, I'm like, everybody should have, FEMA should have a whole department of behavior analysts working for them full time, and NASA should, and every hospital should, and it's amazing. But at least you're starting, and I'm sure there's other examples of behavior analysts working with organizations and making great strides like you. But it is fascinating. So really, it's just looking at a problem, whatever problem is, whether it's an individual with autism or an organization, in terms of training or intervention, and measuring progress and keeping things going in a positive direction. So how can we tie that into families' struggle with finding quote unquote good ABA? And you said like nothing is inherently good or bad. And, so maybe I'm not even asking the question right, but there are quality issues in ABA across the country and across the world. And so what are your thoughts on that?
I absolutely agree. I think actually an article that really spoke to this issue for me was written by Yev Beverka. I'm happy to give you the link to this article, in which she identified that she was a behavior analyst, much like you, and understood the impact of the science and how effective we could be, and then became a parent of a child on the spectrum. And in seeking treatment, because she obviously did not want to be the provider of services for her own child, what that process looked like and how she realized there's just this gap in how services are being provided versus what she was trained to do, what we understand the science may be. And that, she acknowledges that this may not be at all the case across organizations, but that such bad experiences can truly make people have a different perception of what we do as behavior analysts. And it disheartened her as a behavior analyst who knows what we could do. Now, the positive part of this, which I really like that she's done in this article, is she goes on to say that she applied the things that she is familiar with within her home, within her organizational, in the organizations she has access to, which with the settings, and that, she was able to effectively employ and get the right people on board and support services for her child. But I think her story is very telling. And it is absolutely what a lot of our graduates face when we put them out there to become employed. We try to recruit talent, right? And it's not easy. You're dealing with, a shortage of, there's not enough of us as behavior analysts, and there aren't enough programs to produce good behavior analysts in time. So, we have to do some quality control over our graduate programs. But then we graduate them and put them out, and then a good proportion of them are burned out from the systems that they're placed in. And quite often when you ask them what's going on, they'll tell you there's a discrepancy between why they joined the field, which is to be effective agents of change. They wanted to make a difference in families' lives versus what they experience sometimes, which is all the paperwork and administrative and business sides of clinical care. And I think that there is a good proportion of organizations that are doing a wonderful job, and organizations that really need to shape up and do things a little differently. And I think that as a whole, as a field, we're put in a wonderful place when parents and families and individuals provide such feedback to ask ourselves, what the hell are we doing? What's our mission here? Because, I may be crazy, Mary, but I don't think there's a single human being on the face of the planet that says, I'd like to go into autism care, but I'd like to do a subpar job or not, I'm going to not do a great job. No one enters the field, whether you're an investor or you are a clinician or you're administrative care. It doesn't really matter, like no one joins with just this notion of I'm going to do a, subpar work or maybe not the best job I can do. I do think that people come to the profession with the intent to do the best that they can. Now, what changes that likely is the contingencies in place. What type of environments are in place? What are the requirements of them? What does insurance require? What's happening within the state regulations? And how do these things interplay with the labor shortage issues we have that may result in not the best type of service? So I want to begin with that because I don't think that I would give up on anyone who's joined the field. I think anyone who's tried to join the field came to us for good reasons. And I'd like to continue to recruit the talented, brilliant individuals who have the heart and care to make a difference in individuals' lives. Human care services is not easy. So I think we should continue to do that. The other thing that I think we can do and need to move toward is putting forward and adopting quality control issues. So most, recently, after doing a lot of my faculty work, after a good 15 years of that work, I've actually joined Behavioral Health Center of Excellence as their chief science officer. This is an accrediting organization, and I'm very passionate about moving toward accreditation because it provides that layer of an outside objective party coming into your organization and looking to see, are you doing what's best practice in the field? If an organization is just doing what insurance companies require of them, they're likely to not meet the best practice in the field because insurance companies don't necessarily know what those are. They don't have the behavior analysts on board necessarily. And even if they do, they don't have the resources to do the type of thorough job we will do as an accrediting body. And we also have actually on our website a page for families, because to me, that's where the difference is going to come, is for a family to be able to say, is this organization providing good services? The first thing that they can do is to distinguish a good service provider from not so good service provider by identifying one that has agreed to put themselves through accreditation. Because that means they have said, yep, I agree to an outside objective party coming in, reviewing to see, do I have the right staff? Do I train my staff well? Do I provide my staff with the type of resources they need to be able to be good care providers? Are they providing safety skills, and are they providing safe and effective care? Are they approaching treatment planning and coordination as we know it in best practices in our field, or are they just doing what they need to get by? We also look to see, do they create feedback systems with their families, and do they implement those, for example, as a part of their service delivery? And most important, I think, to us lately has become this realization that a lot of service providers that are excellent really attend to what the families need at the big picture, the goals they have for their family, and that they coordinate care to get exactly those types of outcomes. They work toward those outcomes and communicate that to the families. And we're very interested in looking to find organizations that are doing excellent care and say, yep, these individuals are, to be able to distinguish good from maybe not so good. Now, that doesn't mean that if someone's not doing so good, we're like, we give up on you. It just does mean to provide resources and supports. It sometimes means that some contingencies have occurred that have made them move away from some of those things. I have yet to find an organization that does not care to make change and does not want to really do a good job. In fact, when we speak to leadership, always people are proud of what they're trying to do. I just think that sometimes, the contingencies don't set them for success. So I feel accreditation and quality controls like that can really help organizations move toward better quality care.
Yeah, that sounds great. Yeah, I know from a medical point of view, there's like the Joint Commission, and there's people that come in to not just look at the paperwork, but actually look and see, how does this look? And it reminds me, I found you most recently through the National Autism Conference at Penn State. I watched it virtually, and it's a great conference. And I don't know if you know this, but I used to be the lead behavior analyst for the Verbal Behavior Project in Pennsylvania, which is now the Patent Autism ABA Supports Initiative, which runs the whole NAC conference. And early on, Mike Miklos created a rubrics, a site review, and we did that for every classroom throughout Pennsylvania. That was part of and we would go in, an independent person, so I wasn't the consultant for the site. I would go in and do 10 site reviews, and it was a start. Was it perfect? No. And I don't think we ever published any data, but there's a lot of good research there that we did on the ground with our sleeves rolled up to really fine tune. And there were some classrooms that got all the checkbox, but they still weren't great. And Mike said one time, it's like a hollow bunny. It's like a chocolate bunny that you think is solid, and you bite into it and it's hollow. So you also have to watch out for getting all the check boxes, but still there's something off, and and from my perspective, and I don't work in schools or homes anymore, and I'm strictly online. And I think a couple things. I think classrooms or organizations or wherever there is ABA going on, I think it needs to be positive, 5 to 8 positives to every negative. The use of escape extinction is not good. We need to focus heavily on pairing and manding. We need to focus on family and getting a parent to be the captain of the ship, to, if they're willing and able, to really be central to the whole situation. Those are kind of my, gut reactions. Like, I've done blogs and stuff. You go into 2 daycare, you're not even talking autism or anything. You go into 2 daycare classrooms, and you have one where it's, oh, Susie, I love the way you're doing that, da, 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 da. And then you go into the second classroom, and it's like, put that thing away. I told you to keep your legs crisscross applesauce. And, even if you're saying, remember, keep your legs crisscross applesauce, it's still in the negative pile. And, I'm going to put that jump rope away if you don't behave, and you're going to lose recess. Obviously, whether it's a master's degree in ABA, it's a new employer, it's a daycare setting, it's an autism school, it's ABA in your home, we all want to be around positive interactions. And so that's like my number one.
You add something that's really important for me to mention, which is, my entire career, I've been humbled by the experiences families are willing to share. And when they provide feedback, it sits in my heart. It's been super important to me because I don't think I would have done much of what I've done in my career without families guiding me about what their needs are. One of the things I love about our standards at BHCOE is that it obviously is based on the literature and what's best practice, but then actually because we ourselves are accredited by ANSI, which is a commission that actually oversees, provides us with guidance about how to set standards, we have stakeholders that actually look at the standards and tell us what they need to see. That includes families and patients who received services. And it's amazing how often they speak about the 3 top things that's important to them being the caseload of a supervisor. Excuse me. I still have this cough that keeps coming back. Just the right time. They speak about
drink. We can.
No, it's just this wonderful cough that keeps coming back. But we also get families tell us how important turnover is to them, that they, as soon as they feel that they are getting to work with an organization or with an individual, when there's turnover, that it really disrupts care for them. And the other thing that they've been telling us is when someone's here and working with my kid, or when my child's working with someone, the most important thing to me is to see that my kid's happy. Mm-hmm. And these directions we get from families as a part of the standards are really important for me to mention, because I think good quality assurance absolutely includes that parent perspective as a part of the process.
Mm-hmm. And those are my 3 big goals for all kids. My typically developing son, who's in med school, as well as Lucas, who is moderate to severely affected by autism, is the child, we work towards the child being as safe as possible, as independent as possible, and as happy as possible. And those are from the time we start, and it goes onward. And that bar is a moving bar. You don't just get there and then you're like, okay, we're good.
Right.
Constant. And safety to Spencer versus Lucas looks different. Safety, independence looks different. But that's where I am just constantly keeping my eye on those 3 goals. So I'm glad you brought up happiness. And I think that needs to be a really big, a big part of what we do and how we make what we do.
Yeah. And honestly, I wouldn't, it's not an Ellie thing, that I'm just learning. I'm just humbled to be in the journey of individuals who are willing to share some of these things with us that really matter. And I'm not sure if you're familiar with Shafla Rosales, Ali, and she, I love her. She's absolutely a role model. And when she served on our standards committee for training sites, we also have accreditation to make sure that an organization is a good provider of supervision. She brought up how she's been trying to develop material around exactly that, teaching trainees, how can you be in an environment, implement what's prescribed, be, at a place where your skill sets show, but absolutely at forefront of all of that to assure that the child's happy, because that is what you need for them to be learning. And I think that, there are individuals like her that really have gotten this message.
I interviewed Bridget Taylor for the show a while back, and she did an article on compassionate care and, really working with families to make sure that the goals are what they want to. So we can link that in the show notes as well. I think that is a good summary of both of our ideas about how to look for for good quality programs. I hope that your behavioral accreditation is that a newer thing, or is that been going on? Do you have hundreds of organizations, or how widespread is that?
Yeah, actually, BHCOE has been in existence for 7 years now. I've joined within the last 2 years, a little over about that time, actually. And my work is really specific to making sure that what we do is reliable and valid with evaluations. And I continue to help with measurement development at BHCOE. But we have over 500 organizations that have been accredited over that time. And that's really important, because I think that when you're starting up an accreditation, it takes many, many years and data analysis to really make sure you understand where the field is, to even know what you can require. After these 7 years, I've finally been able to get our questionnaire for families, because we do a wide scale survey, to a place where we feel like, okay, we're not asking too many questions. We're actually asking the prudent questions, or our observations. We do observations of the actual therapy sessions and rate those. And, it takes a lot of data to be able to get to a place where you can feel confident about your tools. So I'm glad to say that we are definitely there, and they've been doing this for some time. So
great. Well, I like to, how can people find your work, or do you have a website?
I actually, I'm a public figure, so, just a quick Google search. I would say that if you're interested in quality control, I would absolutely say email me at ellie@bhcoe.org. I'm happy to provide you with that link. And most of my work can be seen on ResearchGate, so I'm easy to find.
And your last name, it's Ellie Kazemi. Kazemi.
Yes.
Okay, and it's Kazemi for those that are listening. But we're going to link everything in the show notes, so you will be able to find Ellie and her very, very important work. So before I let you go, I like to end with the same question. I don't want to just help the kids. I want to help the parents and professionals listening to be less stressed and lead happier lives themselves. So what are your self-care tips or stress management tools?
Well, Mary, I was going to ask you the same. With all of the things that you have accomplished and continue to do, your bright smile and kind gestures make me wonder, where you get all your Zen from.
Well, I actually am answering that on podcast 200, because I am being interviewed for that show. So tune in.
Wonderful. I would say, my recommendation is to know that there's a lot we want. I'm battling with the fact that I know I have one life to live, and I'd like to live that life filled with contributions. I'd like to know I've done some things in this lifetime. And I have to remind myself to just improve 1% every day, and to be kind to myself and forgive myself for the mistakes I made yesterday.
I like that. Continue to improve 1% a day. That seems like a good goal. It has been great getting to know you better, Ellie. I look forward to future collaborations, and I'm sure my listeners are going to love this episode. So thank you so much for your time.
Thank you. It's very, very nice to meet you.